you everyone for being here. It is my distinct honor to be here with Dr. Adam Numis, and he is a pediatric neurologist, epilepsy specialist, researcher, associate professor at UCSF School of Medicine, and more. And we are here to talk about the latest in HIE and epilepsy research. So, Adam, thank you so much for coming and sharing your expertise with us today.
Yeah, thank you for having me. And I apologize. I'm like many of you, I have a cold, so I'm going to be like sipping on tea as I do this to try and verbally continue to talk to you guys without hacking or coughing or
It's
anything
all
like
good. No,
that.
no
It's the
judgment
season.
here.
It's the season for
Tis,
viruses.
tis the season. I understand. I understand. If you maybe just want to introduce yourself and for our community, and you could just provide us with kind of like a career overview, if you will. Um,
Yeah,
your journey
absolutely.
toward becoming who you are and where you are today.
Yeah, so I grew up in New York at City and then went to high school in Jersey. And at that point, really had no idea. I wanted to be a doctor. I wanted to do biomedical stuff, but wasn't quite sure. And then it wasn't until medical school at Harvard where I had a mentor, Dr. Elizabeth Teal, who is a pediatric epilepsy specialist. And I remember her giving us a lecture, and I was just floored by pediatric epilepsy, the uncertainty that families have to deal with as a result of this disease, um, the so many unknowns that existed still. It just was just terrifying to see that, and it was something that drew me as something that I could hopefully help other people with. And so that was really the big change in my career, my first year of medical school. And it really was that one sort of lecture that was like, wow, this is what I'm supposed to do. And so after that, it was kind of just following that path.
Yeah, that's wonderful that you just kind of had like a little aha moment calling.
Yeah.
That's beautiful and good for us too. Because look at all that you've done, and you get to talk to us today. Um, so I know that there are some things that we can't share, like you said about the HEAL study, because those haven't been published yet. But we can focus on another study. If you want to share a quick overview of the NSR, the Neonatal Seizure Registry, and some of the recent key findings from that. Specifically, if you don't mind emphasizing some of the long-standing collaboration with a patient-family involvement.
Yeah.
Yeah.
Absolutely. So, yeah, so my clinical focus is on kids with seizures and epilepsy, and then my research focus kind of dovetails with that, where it really focuses on early onset seizures, so seizures that happen shortly after birth, whether it be from HIE, stroke, genetics, other things like that. And when I was starting, I'm not that old, but even like, 20 years ago, like there wasn't a lot of stuff known about neonatal seizures. Like we kind of knew what the risk factors were, but we didn't know a lot about what do you treat with, when do people come up, all of these other things that were really sort of a black box. And it was Hannah Glass and Renee Shellhouse, who was at University of Michigan, now Washington University in St. Louis, Hannah Glass at University of California, San Francisco, who put together this neonatal seizure registry to answer some really fundamentally important questions that you would have hoped had already been answered, because if you were an adult with stroke or things like that, these questions had already been answered in those kind of groups. But not as much attention sometimes happens in the pediatric space. And so they really set out to form this multi-center collaboration across the country of centers that were really interested in helping solve these problems and answer these questions for both families and science, and sort of hit it out of the park over the last decade with these different research studies that really didn't just answer questions that we wanted to know, but as you're saying, right, they early on were able to form collaborations with parent partners. And so as a part of that, they meet monthly to get feedback on the different research studies we're doing, to get feedback on sort of the different ins and outs of like, well, is this a priority for families? What should we be really looking at, right? And so making sure that we're melding the science with the feedback that we're getting from families to make sure that the things we do, which we know are time intensive and expensive, are really helping answer the questions that need to be answered, that are really important to the people and the families who are taking care of children who experience things like this.
That's wonderful. Um, so what are some of the recent key findings, maybe from that study, like regarding neonatal seizures and regarding like risk for infantile spasms that you're able to share?
Yeah, so neonatal seizures happen in about one in 500 kids. So it's actually not that uncommon, right? The vast majority are a result of, they're called provoked seizures related to some type of injury, such as HIE, stroke, infection, alterations in sodium levels, things like that. And then the other smaller minority are the first manifestations of epilepsy, which is a predisposition towards additional seizures, usually related to some genetic change that makes someone more likely to experience recurrent seizures. So in that space, kids with acute provoked seizures, so again, those are the ones related to HIE or stroke, there was a lot of debate as to how long do kids need to be treated, right? So we know that these seizures are just really related to the injury that's happening. They're almost like a symptom, right?
Mm.
And we know that only about 1 in 7 of those kids will develop epilepsy later on. Again, epilepsy being that predilection towards additional seizures that are not provoked. And so you have 1 in 7 kids that are going to develop epilepsy, and yet so many kids were going home on drugs like phenobarbital and levetiracetam, and we didn't really know, was that the right way to do it? What were we helping decrease the risk of epilepsy later on? Did kids need to be on this for weeks, months, years, or could they, yeah, just a few days or maybe a week or two of these medications? And so this was an important thing for both Dr. Glass and Dr. Shellhouse, as well as families, right? We really didn't know. And the practice parameter, the practice changes between centers, both within states and across states, were wildly different, right? And even within centers, people practice differently. And so I think one of the coolest things that they really set out to do was to look, right? Does it matter, right? So instead of randomizing people to receive months or a year of phenobarbital and levetiracetam versus a week, what they did was they took all these different centers that were doing different things and they said, okay, let's just follow these kids, right? We're not going to tell the providers or families, what to do because we don't know what to do. But
Yeah.
instead, just like follow people in these different centers and see, does it matter if you're on it for just a few days or a week or so? Does it matter if you're on it for months at a time? And it turns out it doesn't matter. The length of duration of that does not matter. So I think one of the coolest things, one of the biggest things was showing that after a provoked seizure, right? Again, from HIE, stroke, infection, you don't need to be on these medications for months at a time, right? You can be on them for short periods of time, and it doesn't increase your risk of epilepsy. It doesn't increase your risk of intellectual disability or developmental delay. And so exposing kids to these medications for months, years isn't helpful like we potentially thought it could be. And so really, really honing in and making sure that we know and kind of convey to families that really short periods of these medications just to control the seizures right in that at-risk period is really the best thing we can do. And then quickly get kids off because it doesn't change the long-term effects of the injury that occurred.
And does that also go the same for, because I know you mentioned epilepsy, does that also apply to infantile spasms? Is there a correlation
Well,
between the,
yeah. So we're still working on that. So
oh,
it doesn't affect the development of spasms. So like I was saying, so about 1 in 7 kids after a brain injury who've had seizures will develop epilepsy. And some of those kids will develop infantile spasms, which is a type of epilepsy that everyone may be familiar with. It's a particularly severe type of epilepsy where the longer it goes on, the more likelihood there is for ongoing intellectual disability. So
mhm.
it's one of those things where it's not just the recurrent seizures, but it's the impact on development that is so striking and concerning when these develop. The study we showed these medications don't prevent it, right? We know that these,
Mhm.
it doesn't matter. You can be on them for months, years at a time. It doesn't prevent the spasms. So why give people additional medication if you don't have to? So that's
Right.
really been a key feature of that study. Implementing the research that we've done is another really big thing that we're trying to do. And I know Dr. Glass and Dr. Shellhouse are thinking of different ways and different funding mechanisms to really get this out there so that every center across the United States and hopefully globally isn't just giving these medications out and exposing kids to medications they may not need. And again, although it doesn't prevent epilepsy and although it doesn't prevent infantile spasms, what we're doing is we're creating risk factor profiles. So we're trying to, use, like everyone is, AI is a big word. We've been using it in
Hmm.
science for years. And so we're using things like this to try to create risk profiles to help understand who's at most risk for developing epilepsy and in particular infantile spasms. As a part of one of the research studies that the Neonatal Seizure Registry did, called NSR Spasms, we did just that, where we looked at all of the kids enrolled in these different NSR studies, and we said, okay, what are the risk factors for developing infantile spasms? Um, like I said, not a ton of kids maybe develop spasms. So in the small amount that did develop spasms as a result of seizures after HIE, they were able to find markers on MRI and EEG that help predict about 50% likelihood of developing spasms. So it's an initial model that's been published a couple years ago, and we're hoping as we enroll more kids into these different NSR studies, it's something that we can validate so that we can make it sort of a clinical risk prediction tool to really help identify those kids who are at highest risk. And, what do we do with that information? Well, we just make sure parents are knowledgeable about what to look for, right? The
Hmm.
first sign of something, getting those kids in and making sure we're treating them with the right kind of therapies. That's the best thing we can do to prevent any long-term sort of cognitive effects from these types of seizures.
Wonderful. So as you said, like the implementation of that research is kind of a whole nother stage.
Yeah,
I mean,
yeah.
yeah, and that's probably, do you feel like that's something that, like, is going to take a long time to kind of become, well known amongst all of these medical facilities, or?
Yeah, we're trying. It's interesting, right? The research we do to find the answers is a totally different type of research that you do to implement the science. So
Hmm.
you do research to find the answers, and then making sure that that's advertised is a whole different field,
It's a
right?
whole nother,
And
yeah.
for people who have backgrounds in marketing, like that's we don't. Like the
Right.
researchers don't have backgrounds in marketing,
Right.
and so implementing. I mean, it takes money, right, to kind of
Yeah.
kind of do these campaigns and do this. So if there's anyone who has, the money to potentially help us, please reach out because
Yeah.
these are expensive things to do. So I know that they're working hard in thinking with different organizations to try and help fundraise and or write grants essentially to do
Yeah.
this because it takes, unbeknownst to me, many millions of dollars to really get the word
Wow.
out there and really make sure that people know what the current state of the art is.
Yeah.
Yeah.
I mean, and
I
that's
thought it was
something that
like,
I,
yeah, please, yeah.
I was just
Um,
gonna say, I thought you just do the research and then like bada boom, bada bing, and it just
yeah,
shows how naive that I am when it comes to
yeah.
just,
Yeah,
yeah,
no, me too. Implementation science is a whole other
yeah.
field of, what are the tactics? What are the strategies you use? And again,
Hmm.
people with marketing backgrounds probably will know this much better.
Yeah.
But it's a huge step and a huge hurdle. And
Yeah.
so we know that even though this research is out there, it's
Hmm.
not necessarily being practiced everywhere. And then
Right.
how do you get that out to people? How do you show them the data? How do you convince people and families that this is what we need to
That's the
do?
way to
So
go. Yeah.
that's the next step. And so I know
The-
we're hoping, in the next year or so that we really start that campaign to
Cool.
really get this stuff out there. But it's stuff like this that helps families know about it, right? It's word of
Yeah.
mouth, right?
Yeah.
That's so important to get these messages out.
Yeah. And that's why we appreciate you being here and explaining it to everyone too. So I know that if there are any updates you're also able to provide regarding there, I guess there are a lot of studies going on with NSR. There's NSR DEV. What does that stand for?
Yeah. So like you said, we basically, when we're not seeing patients and doing the research, we're writing grants to try to get money to do
Hmm.
additional stuff and learn more about seizures after HI and stroke and infection. NSR-DEV is a study that's looking at long-term developments over 5, 6, 7 years. So the studies we've done so far only look at development after the first 2 years after seizures. And so this next study is looking at the long-term longitudinal outcomes and follow-ups, right? Hard to do. This particular group is uniquely qualified to really look at this and research this.
Hmm.
We have amazing engagement with families, again, largely owing to the parent um, bonds that we have with our parent focus groups. We've been able to really keep people in these studies, not keep them in, but really continuously engage with them so that they want to continuously participate and help
Yeah.
us understand these, again, very important questions that in the past were maybe not studied as rigorously as we would have hoped. So NSR-DEV is really, again, focused on what are these long-term outcomes, right? What is really, how many people, we know how many kids may develop epilepsy after 2 years, but how about 5 years, 6 years, 7 years?
Mm.
And then what do the learning profiles look like? What do we need to really be focusing on? What aspects of development? Is it all of them? Are there particular profiles that we should be telling families to really focus on?
Mm.
And so it's really that. And that study is ending soon. So we should have results in the next year or so as to what this looks like, right? What if you've had seizures after HIE? What does that look like? And
Yeah.
what do we need to be focusing on? And so, yeah, the study is nearly complete. So I'm hoping in the next year we'll have more data for you.
Wonderful. There's also another one, NSR-GENE. Is that about genetic factors?
Yeah, so big thing, right? So, like I was saying, we're hoping to find risk predictions, right, for development of epilepsy after provoked seizures. And we don't have a lot of great data to help us. One in
Hmm.
seven is the number we give families because we know if you've had seizures after an injury, that is the risk of developing epilepsy, 1 in 7. That's not a fun number for me to give to families. It's not a fun number for families to receive. And we get that, right? I want to tell you, 95% yes, 95% no, right? Like that's a
Hmm.
much better number to give. And
Yeah.
so a lot of the focus of my career is trying to help answer a lot of that uncertainty. I don't like uncertainty. I know families don't like uncertainty. It causes anxiety. It causes a lot of repercussions throughout families. And it's nothing that we enjoy saying. 1 in 7 is better than 50-50, but it's not great, right? So that's really what we're trying to do is really do a better job of helping understand what kids are at most risk for having, outcomes that need to be followed for things like epilepsy or learning disabilities.
Hmm.
NSR-GENE is a study that's looking to tackle that question with a focus on the genetic underpinnings of epilepsy specifically. So what we're doing is we're looking at different types of genetic testing and how we can potentially put those together to help, again, develop these risk profiles to say, okay, well, can we do better than 1 in 7? Can we say, again, 95% chance, yes or no, right? If we can get there, then we're going to be a lot better off, both for families and ourselves as we're trying to understand um, what's causing this and hopefully how to prevent it. So
Hmm.
that study, it's a 5-year study. We're currently in year 2 of that. And so we're enrolling across the country in children who've had a history of provoked seizures. Um, what we're enrolling these kids again across the country, doing these genetic tests, and we'll have data for this in about 3 years. So we're
Okay.
getting there. It'll be a
You
little
are.
bit of time, but it's exciting. Again, it's something that's been done in adults with different sort of conditions, but hasn't been done in babies. So
And
first of its kind.
first of its kind. I keep asking all these questions. I have one more. The NSR-RISE.
Yeah,
If you
that's
could
one that,
explain.
yeah, near and dear to my heart. So
Hmm.
one of the things that we think underlies the causes of these detrimental effects of seizures is inflammation. And so that's been a focus of my research, is looking at how inflammation plays a role in the development of epilepsy or other consequences like learning disabilities.
Hmm.
This was a pilot study where we enrolled just about 70 kids um, to look at, in their blood, can we see these inflammatory signatures that might help understand why it's happening and how to tell parents, again, predicting, right? Giving better than, there's a chance, it's a chance. I can't tell you more than that, right? 15%, not a great number, right? I
Right.
want to be able to do better than that. And so this is really a study that's looking at that. We've completed the enrollment. We're in the last 6 months of our follow-up, and so we're going to have results pretty soon that look at predicting epilepsy. And we think we have a pretty good biomarker signature in these inflammatory proteins. Already, we can say, you know, There have been pathways in different animal studies, right? Mice studies, rat studies that have looked at the role of inflammation after, different types of injuries that they cause. I mean, people are not the same as animals, right? We're not the same as
Mhm.
mice or rats. So the biggest thing that I wanted to do was really, okay, well, we know these things are happening in these animal models where they can prevent epilepsy from developing, which is crazy, right? They give, excuse me, a cocktail of different anti-inflammatory medications, and they can stop the seizures. Of course, we need to show that these same pathways are dysregulated in people, right? We can't just give people these medications that they gave to rats. That's not at all okay. So what we're doing is
Mhm.
showing that these pathways are dysregulated first in hopes of being able to use those same medications to stop epilepsy from developing in people. So the first thing that we did was we said, okay, well, let's just look in the kids who have seizures compared to the kids who don't have seizures.
Mhm.
What inflammatory signals are changed? And they look exactly like the pathways that were changed in these animal models. And so particular changes in the JAK-STAT pathway and the IL-1 beta pathway seem to be changed. And again, what's cool is those are the pathways they targeted to stop the epilepsy from developing later on. So I think we've gotten some preliminary data already that's really been really cool and really shows us a lot of promise towards eventually hitting our goal, which is again, preventing epilepsy, right?
Right,
Epilepsy is a
right.
terrible disease. We want to really be able to tell people, what are the chances of your child having this? And then,
Yeah.
you know, hopefully, eventually coming up with a clinical trial that helps prevent it from happening.
Yeah. Remind me if you haven't said already, when does the NSR-RISE one conclude?
6 months. Yeah, pretty soon.
Oh, okay.
Yeah.
So soon. Okay.
We're currently submitting another grant to the NIH, to the government, to do a much larger study, right? This was a smaller
Okay.
one, looking just to get the preliminary data, right? Is this
Yeah.
even there? Is this real? This next one will look at, over 200 kids throughout the country to
Okay.
confirm these findings. Again, you need to measure 2, 3 times before we're talking about potentially a
Right.
clinical trial where we're exposing kids to drugs. We really
Right.
want to make sure we understand these pathways and understand that what we're doing is going to be helpful. And so that will be submitted in February. So all
Okay.
of the NSR centers are super excited to participate. And if that goes, we'll start enrolling in September of 2024. That'll
Oh,
be the start of
wonderful.
that study. Yeah.
When I've spoken to researchers before, sometimes, especially when it comes to like HIE, a barrier to research in clinical trials has always been, you know, finding finding the actual, children or babies to do it. Just because by the time it's diagnosed or not, it
Yeah.
might be too late. Is that a barrier that you've had to overcome, or have you feel like enrollment in these studies has been relatively easy for you?
It's actually been relatively easy. We were
Okay.
enrolling during COVID and still were able to hit our targets in a
Wow.
pretty reasonable time frame. I think one of the most important factors was having our parent group, our parent partners involved, because they've actually been a core reason why we've been able to
Mm,
keep enrolling and enrolling effectively. Because they're giving us what we need, it's a partnership, right? We're
yeah.
telling them what things we're really hoping to get from research. They're telling us what things they're hoping to get, and they're
Hmm.
helping us understand what are the best ways to talk to families about these things.
Yeah.
What are the best ways, in very stressful situations that we know are happening, how do you really talk to families and help them understand the importance of something like this? So
Yeah.
I think in our particular case, the neonatal seizure registry has been just from the get-go hugely, hugely important with their parent partnerships and really helping move the field forward and not running into some of those issues with enrollment. So
Yeah.
that's an awesome thing that I have to constantly convince reviewers, right? Because that's
Yeah.
what they're like, well, how people are gonna, these are stressed families. Why would they want to
Hmm.
participate? And I think the thing is, families do is just how do you approach families in these stressful situations? How do you talk to them? How do you let them know that this is, what we're striving for? And those parent
Right.
partnerships have been key in, helping us get the message across and
Yeah.
doing so in a very sensitive sort of way.
I think this is a good segue into the next question, which is really, if you don't mind educating our families about what can be gained about participating in these studies or participating in clinical trials when it comes to that. Like, what are some of the potential benefits, specifically for Hope for HIE families?
Yeah, great question. Again, so like I was saying, up until a couple of years ago, we had no idea whether we should keep kids on phenobarbital for months, years at a time, or whether they should go home without it. That research, hundreds of families participated in research studies to help us understand this, but without that participation, we would have never known. And now we know it doesn't matter. So kids shouldn't leave the hospital with these medications being taken in most cases. So if you have provoked seizures as a result of brain injury like HIE, and the seizures stop and you're on these medications, we know it's okay to stop them. Let the child tell you if they still need it. And if they don't need it. They don't need it for
Yeah,
months and years at a time. And so that is directly related to the families that participated in these research studies. And so, again, it may not help families in the moment, right? The studies that
hmm
we do aren't clinical trials where we're giving medications that might
right.
actually change something, but it's helping the next set of families, understand more. And
Yeah,
so it's hard because it's not necessarily a direct benefit to a family when they participate in these particular studies, but the it's knowing that you're helping remove uncertainty for families that are coming, right?
hmm
As I said, for the genetic study, for the RISE study that we're talking about,
hmm
genetics and inflammation, the goal is to really do better than what we're doing and give people really important numbers is to say, okay, what is the risk? What are we looking at, right? What
Yeah,
does the next few years look like? How often do you need EEGs? How often do you need to see your neurologist? Do you
hmm
need to see an epilepsy specialist, right? Those sort of questions are things that I think fundamentally need to be answered.
yeah,
And when people participate in research studies like that, that's what we're striving to help with. So again, although families that are participating may not see that benefit right away, they're paving the way for families in the future to understand this and have hopefully a better understanding and better experience after
yeah.
something like this.
And to bring a little bit more knowledge into the unknown, which is
Yeah,
what they're all
exactly.
experiencing. And it's probably going to be a very similar answer to the one you just said, but what are some of the potential benefits just in the field of pediatric neurology
Yeah.
that comes from these studies, that comes from these clinical trials?
Yeah, I think these are certainly shifting the paradigm, right? They're important because we're answering questions people have wanted to know, but these studies
Mhm.
are hard, right? Enrolling kids from 10 centers takes a lot of coordination and a lot of effort. Again, the parent partnerships have been huge. But it's also finding a set of investigators clinical researchers who are comfortable working with each other and not
Mhm.
having these big egos, right? I think that's been really cool to be a part of this organization is everyone wants to help the same way. We all really want to help answer the questions that are at our minds that need to be answered.
Mhm.
And so NSR has been an amazing organization for that, where they really help people of all sort of stages of their career really help implement some of these cool ideas and make sure that we're, again, focusing on what needs to happen, both in the field, not just for pediatric neurology, but what parents want to bring to the table, right? Because sometimes those goals are aligned, sometimes they're a little off, and making sure that we're doing what's helpful for everyone, I think is so important. The field has really changed, as you mentioned. I mean, some of the studies I'm highlighting, there's many more.
Mhm.
If you look at the neonatal seizure registry website, you can see a more detailed kind of listing of the research studies that have happened. But it has had a fundamental change in it, the way we think of neonatal neurology, which is a big part of pediatric neurology. So it's, again, just amazing kudos to Dr. Glass and Dr. Shellhouse for having the vision to start this and then bringing it to where it is now.
Yeah, it's amazing. Um, for so many of our families, when they look at getting involved in clinical trials, it's helpful. We're really trying to bridge the gap of like health
Yeah.
literacy, if you will, and build our resources for parents. So they don't know what they don't know, and so what is your advice or what resources or information would you give to parents who are considering involvement in a clinical trial to help them make more informed decisions?
Yeah, I think the first step is just making sure that whoever you're talking to about the research study, that's your primary contact. And again, if
Mhm.
it's a neonatal seizure registry study, we have flyers that parent families and parent partners have helped us develop to really help hone in what the important information is. So making sure you're asking all the questions that you need to feel fully informed is important. That's like step one, because that's what they're there for. They are not there to just like quickly tell you something and then leave. They want to be able to help you. We all want to make sure that families have a very informed sort of they as are informed as possible to make these decisions. There are websites that we often have to help with that information. And again, the Neonatal Seizure Registry website is one of those that is there to help give information to families. And then I think, the Hope for HIE website, right? It's an amazing resource as well. I often will send families to that particular website because the toolbox you guys have created is just absurdly amazing, right? So I will send families to your website a lot. So, but again, the people on the ground who are talking to you, they know a lot and do not feel pressured, do not feel like they're there for that. Their
Right.
job is to help you understand what you're getting into and making sure that that's a good fit for you and your family.
I know that, previously in our conversation, we talked about the challenges of marketing and implementation of a lot of these research.
Yeah.
Uh, Aside from that, are there other specific challenges or even opportunities, I guess, that you've encountered in help bridging the gap between research and practice?
Yeah, great question. It's funding, right? I
Big
mean,
question.
for lots of people, as you were saying, like enrollment is a big issue in these studies. For us, enrollment isn't the issue. It's the
Yeah.
funding. And
Okay.
we are vigorously writing to different foundations and the government to obtain funding to be able to do this, right? It's convincing scientists that this is important, right? The people on a lot of these organizational boards are scientists, not necessarily families. And so we have to convince them that A, babies matter. It's crazy, but that's something we have to convince people of, and that this is important. That it's a really critical topic for people, and so that's our job, is doing that. But certainly, if there are these studies, as you can imagine, when you're enrolling hundreds of kids at multiple
Yeah.
different centers, these are expensive studies on the order of anywhere
Hmm.
between $2 to $5 million. So
Wow.
per study, sometimes more. So, of course, if there are, benevolent people out there with that sort of money to be able to donate, let us know, that we can do some of the things even sooner than we're hoping. But
Yeah.
we'd love to do as many things as we can, but it's a matter of, again, getting the
Yeah.
funding to be able to do this. So, just a pitch to,
Just a bit.
you know, again, if there's anyone out there who has, who has the means to be able to make that kind of contribution, we're here. I think our track record speaks for itself, and we are,
Yeah.
we're trying.
And I'm sure that there are other forms of advocacy that parents or community members could get involved in too, like you said, marketing and
Absolutely,
things like that, word of
absolutely.
mouth. And
Yeah,
but yeah, but this, like you said, this is kind of the first step, just being aware that it's even out there, that it's
yeah,
existing, and that these studies are taking place is step number one. So
exactly.
um
Yeah.
if you are able, I don't know if you're able to answer this question. Are you able to respond to like what's next for research when it comes to HIE, neonatal
Yeah.
seizures, and epilepsy?
Yeah, so this next study that so this will go to the National Institutes of Health, a governmental organization that funds a lot of our research, a lot of biomedical research in this country. That grant that's looking to look at these inflammatory signatures in hundreds of kids is going out there.
Okay.
What we've done so far is we've been looking in the blood of kids, small amounts of blood. We figured out a way to look at all these inflammation signals in tiny, tiny bits of blood. Um, that's, certainly what we're seeing in the blood isn't total, it's not, there's things from every organ in your blood. What we're going to be doing in this next study is actually looking inside little tiny vesicles that come from the brain to look at these signatures in the blood. So your nerve cells and your supporting cells around those nerve cells communicate with these tiny little vesicles, and they cross into your blood. And what we've done now is we've been able to isolate those. So we're looking in the blood for these inflammation signatures, but we're also, in a way, looking directly in the brain to show that potentially these signals are changed in the same way that we see in the blood. So that, again, lending support before we're going to do any clinical
Hmm.
trial exposing kids to medications that
Right.
potentially could help, we need to be 100% sure that what we're talking about is correct. And so that's
Right.
right now, I think we're laying the groundwork for clinical trials in the future in the next 5 to 10 years that really support potential medication interventions that help us. So that's really, I think, where we see the field kind of changing in the next 5 to 10 years.
That's wonderful. When it comes to enrolling in clinical trials or learning more about clinical trials, when the stage of research gets there,
Yeah.
are there websites or places that you recommend parents can go to learn more about that?
Yeah, so if it's again a neonatal seizure registry study, just Google neonatal seizure registry.
And
It's the
yeah,
top thing that comes up. But it's neonatalseizureregistry.ucsf.edu. It gives you tons of information on all the different studies that we're doing. And then, again, I tell people hope for
hope
HIE,
for
right? That
yeah,
toolbox,
okay.
I mean, come on, that's like ridiculous. I mean, that was developed so, I mean, you guys have done an incredible job for it, but it is such an incredible toolbox. It goes over so many different things. Um, and then we actually have handouts as well. Although handouts are like kind of crazy, we do have like handouts that go over a lot of these studies as well. So,
Okay.
the research coordinator or the physician that's helping you understand what this research entails, they'll be able to talk to you more with different things. But the two websites, the Neonatal Seizure Registry
Okay.
website, both for HIE, and if it's epilepsy related,
Hmm.
the Epilepsy Foundation. That's a US-based organization. Epilepsy Foundation is a really good resource as well.
Wonderful. Um, Thank you so much for taking the time to go over all of that information with us. And it's been such a privilege to talk to you. And I know that, speaking for our community, we're very excited for implementation, for just this knowledge base to be formed, and just like as you said, to kind of pave the way even for future families, to give them some empowerment in a time that is stressful and where they just don't have a lot of information. So we just really appreciate all the work that you're doing. And it's been such a pleasure to talk to you today.
Yeah, thank you. One more plug, I forgot. The Newborn Brain Society,
Oh yeah,
.org is another organization that also helps families that has a lot of information for this stuff. So
yes.
I'd be amiss if I didn't include like that one as well. So
Oh, that's all. I mean,
certainly,
we're
yeah.
familiar with that one. I know Betsy
Okay,
talks about
okay.
that one all the
Okay,
time.
cool,
Yeah,
good. I don't want to leave anybody out. I'm sure I am, but those are the important ones. Yeah,
yeah. Thank you so much for your time.
yeah,
And for everyone in our community, just so you know, we will create a blog out of this. We will create some social media takeaways. And of course, this edited recording, of course, will be available on all of our social media channels as well as our YouTube channel. So thank you again, Adam, for joining us. And it's been a pleasure.
thank you.